Okay, so traditionally when we're feeding babies, they're more in a flatter position like this and cuddled in. And when they're in this position, the flow of the milk goes too fast into the baby. So when we're using paced bottle feeding, which is a way of controlling the flow of breast milk or formula so that the baby can feed at a more comfortable pace, we have the baby in a more upright position, and then we tickle the upper lip and we wait for the baby to gape and ask for the bottle. Yeah, do you want it? Yeah, like that, good girl. And initially we don't have the teeth full. We wait for a few sucks and then tip it up so the bottle is at a much more horizontal angle than you traditionally feed a baby in. And this way we want the baby to slow down the flow of the feed going into them. So you let her have a few sucks. If she's gulping, we're going to tip it down, let her take a couple of breaths and then back up again and just watch the flow. Good. And slow it down again. And take a breath and then back up again. So when we feed babies this way, it's much more comfortable for them. We used to think that babies had a preference or would get nipple confused. Now we understand that it's more about flow preference. So babies get used to a faster flow. So if we want a baby to go between breastfeeding and bottle feeding, it's important that we don't give the flow of the milk too fast. So this is a way of comfortably feeding a baby. It's also very good for babies who are just formula feeding or bottle feeding. Okay. People worry that babies take in too much air when you're feeding babies this way. But we all take in air when we're feeding. In this slow pace, they can push some air out through their nose and they will burp after the feed. So we just sit them upright and wait for the burp to come. So when you're offering the bottle again you look for the gape and see. And if the baby is done, they won't accept the bottle again.